My name is Ken Casey. I am the author of this book called The Casey Diet. Add 10 years to your life. The book is about how to live longer and healthier by diet and exercise without medication. The book shows how the Casey diet can lower blood pressure, sugar, glucose, and cholesterol without resorting to calorie counting or vegetarian diets. The Casey diet also substantially reduces atherosclerosis, stroke, and vascular dementia. The book further shows how to lower blood pressure by the use of potassium supplements, how to reduce osteoporosis by the use of alkaline supplements, and how to prevent gout using vitamin C supplements. Lesson 1. Stop atherosclerosis with the Casey diet. Keeping atherosclerosis, or narrowing of the arteries, under control is the single most important aspect of an optimal lifestyle. The term arteriosclerosis is often used synonymously with atherosclerosis, but it actually is a broader term that includes any hardening of the arteries, whether or not due to clogging of the arteries. What causes atherosclerosis? It is caused by high blood pressure, high blood glucose levels, and high cholesterol levels. Keeping all these elements in check through medication will not stop the advance of atherosclerosis. The key is to get to the root of the problem, which is the ingestion of saturated fat laid down in the arteries as cholesterol in the form of plaque. A diet of saturated fat increases the amount of cholesterol in the bloodstream because the liver releases more low-density LDL cholesterol with a diet high in saturated fat. High circulating levels of glucose tend to attach to circulating LDL cholesterol in a process called glycation. This results in advanced glycation end products that promote the oxidation of the LDL cholesterol. Advanced glycation end products, AGEs, are very sticky and are laid down as plaque, especially where the artery wall is damaged by high blood pressure or smoking. Diabetics are particularly prone to the danger of AGEs. Not only do AGEs contribute to atherosclerosis, but they can also clog small blood vessels, especially in the glomerular filters of the kidneys and in the retina of the eye. In addition, AGEs can exist in foods. Grilling or broiling food to over 400 degrees can result in advanced glycation end products through the Maillard process. One should avoid blackened meat or charred fat. You can still enjoy your London broil by cutting off the burnt surface and charred fat. The Casey diet helps to reduce the amounts of AGEs by keeping the circulating blood sugar low in people who would otherwise suffer from pre-diabetes. The Casey diet also reduces the level of LDL cholesterol by encouraging people to reduce their level of red meat and thereby reduce their level of saturated fat. This keeps the circulating LDL cholesterol at a moderately low level. The result is that the body produces fewer AGEs. In addition, the Casey diet encourages one not to brown meat through grilling or broiling. In the 1980s, Nathan Pritikin, who was not a doctor, popularized a low-fat diet as the answer to atherosclerosis. In the 1990s, Dr. Dean Ornish invented a diet which had no saturated fat. Dr. Ornish discovered that his diet could actually reverse atherosclerosis. The diet is virtually impossible to follow for more than a few months, so Dr. Ornish devised a diet with a limited amount of meat. Dr. Ornish found that his diet also reduced blood pressure as well as atherosclerosis. The blood flows more like water than greasy water because of the elimination of animal fats in the diet. Blood pressure is also reduced by the potassium in the fruits and vegetables, which make up a large part of the Ornish diet. In the mid-1990s, the NIH promoted the DASH diet for dietary approaches to stop hypertension, which is similar to the Ornish diet. The Casey diet has the same effect as the Ornish and DASH diets. The Casey diet simply involves eating one meal per day with no snacks. The Casey diet permits you to ingest meat although you are encouraged to keep the portion of red meat down to 3 ounces or less. The Casey diet also encourages you to use monounsaturated fats such as olive oil as much as you wish. The advantage of the Casey diet is that there is no calorie counting, no restriction of favored foods, and no restriction of the amount you eat. As a result, the Casey diet is much easier to follow than the Ornish or DASH diets. It might be better to call the Casey diet a lifestyle alternative rather than a diet. Very low-fat diets are a non-starter for the average person since we as humans are programmed to love fat. The reason eating meat is not deleterious in the Casey diet is that all the fat from the meat will be consumed within 24 hours after ingestion. You should not feel hungry during the day on the Casey diet. However, you may feel thirsty and translate that into hunger. The solution is to periodically drink some water during the day. What is the danger in atherosclerosis? If a coronary artery is narrowed by less than 70%, the blood will flow normally. It would therefore seem that atherosclerosis is not that dangerous. However, when plaque is laid down in the wall, i.e. in the endothelium of the artery, it initially is unstable. Eventually, the plaque will calcify and become stable. Unstable plaque can rupture and form a blood clot, which can block the artery even though the artery is less than 50% clogged by atherosclerosis. If the blood clot does not completely block the coronary artery, part of the heart muscle fed by the artery may still be damaged. Most doctors will prescribe a stent after a coronary event. If there is blockage of the left anterior descending artery, the LAD, or if there is blockage in more than one coronary artery, a coronary artery bypass graft called a CABG, or what the doctors call CABG, will probably be performed. Studies have shown that an artery that is stented will usually progress to more blockage within a few years. The same is true of CABG intervention. As a consequence, many studies have failed to demonstrate any significant increase in survival from either bypass surgery or balloon angioplasty, i.e. stenting, compared to patients that just receive medications such as beta blocker drugs, aspirin, or statins. Atherosclerosis does not occur solely in the coronary arteries. It occurs in all the arteries. When narrowing occurs in the brain, it is called a stroke. When the narrowing occurs in the legs, it is called peripheral arterial disease, known as PAD, P-A-D. Narrowing in the neck's carotid arteries often causes clots due to the turbulence resulting from the blockage, i.e. stenosis. These clots can then get stuck in the arterioles of the brain, causing mini strokes, i.e. transient ischemic attacks, or TIAs, or worse, stroke. About 10 to 15% of ischemic attacks occur due to blockage in the carotid arteries. The classic symptom of PAD is leg pain when walking, which resolves with rest. This is known as intermittent claudication. This occurs because the leg does not receive enough blood flow to keep up with the demand. Up to 50% of cases of PAD are without symptoms because the body grows blood vessels that go around the blockages. Approximately 10 million Americans have PAD. PAD affects up to 20% of those over the age 70. PAD also affects 1 in 3 diabetics over the age of 50. People with PAD have a 4 to 5 times higher risk of heart attack or stroke. Despite its prevalence, only 25% of PAD patients are undergoing treatment. One of the greatest dangers of PAD is the development of a pulmonary embolism. This usually happens when a blood clot in the leg, called a deep vein thrombosis, travels to your lungs and blocks a blood vessel. That leads to low oxygen levels in your blood and can also cause heart failure. It is estimated that each year 600,000 American patients develop pulmonary embolism and that 60,000 die of this complication. This number of deaths exceed the number of American women who die each year from breast cancer. Ischemic stroke occurs when the arteries to your brain become narrowed or blocked by atherosclerosis. About 85% of strokes are ischemic strokes. In 2013, approximately 10.3 million Americans had a stroke. Stroke accounts for over 6 million deaths per year, about 12% of the total deaths. Half of people who have had a stroke live less than 1 year. In 2010, there were 33 million people who had previously had a stroke and were still alive. The main risk factor for stroke is high blood pressure. Other risk factors include smoking, high blood sugar, high blood cholesterol, a previous transient ischemic attack, in other words, a mini stroke, and atrial fibrillation. The beauty of the Casey diet, combined with exercise, is that it dramatically reduces the likelihood of a stroke. Lesson 2. Stop type 2 diabetes with the Casey diet. Diabetes is wreaking havoc on the health of over 29 million Americans. Diabetes is defined as fasting blood glucose levels above 125 milligrams per deciliter. Less well known is that there are another 86 million Americans living with prediabetes, more than 1 out of every 3 adults, a condition defined by elevated blood sugar levels between 100 to 125 milligrams per deciliter. Approximately 90% of these people do not know they have prediabetes. Prediabetes puts you at increased risk of developing type 2 diabetes, heart disease, and stroke. The Centers for Disease Control estimates that 51% of U.S. adults over 65 have prediabetes, i.e., some form of insulin resistance. The classic symptoms of untreated diabetes are increased urination, increased thirst, and increased hunger. In addition, symptoms may include blurry vision, headache, fatigue, slow healing of cuts, and itchy skin. Diabetes is a major risk factor for atherosclerosis, namely clogged arteries, which means that diabetics are more likely to suffer from strokes and heart failure. Atherosclerosis occurs because of glycation. Glycation refers to the process of attaching a glucose molecule, i.e., a sugar molecule, to another molecule such as fat, usually cholesterol or triglycerides. The glycated sugars are very sticky and quickly adhere to any damage to the lining of an artery due to such events as smoking or high blood pressure. The result is plaque, which eventually will calcify. Secondly, diabetes is a major cause of neuropathy, i.e., nerve damage, including diabetic retinopathy. About 2/3 of diabetic men will suffer from at least a mild case of nerve damage. If adopted in time, the Casey diet will restore blood circulation to peripheral nerves, particularly those in the hand and feet. If not done in time, gangrene can set in. In diabetic retinopathy, blood vessels in the retina of the eye are damaged, which can result in gradual vision loss and blindness. Thirdly, diabetes is a major cause of kidney dysfunction, along with high blood pressure. This can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease, sometimes requiring dialysis or a kidney transplant. When glycated sugars gum up the arterioles of the glomeruli, i.e., the filters in the kidney, thousands of these glomeruli die. By age 60, 40% of the glomeruli will be gone, even though the patient does not yet have full-blown diabetes. Between 10% and 20% of diabetics will develop chronic kidney disease at some point in their lives. Finally, diabetes is linked to cognitive deficit. Those with diabetes have a 1.5-fold greater rate of decline in cognitive function, which is probably due to mitochondrial starvation in the brain neurons. Approximately 2 to 5 million Americans die of diabetes every year. 75% of deaths in diabetics are due to coronary artery disease. There are 2 main tests to diagnose diabetes or prediabetes. The fasting plasma glucose FPG test measures your fasting blood glucose levels. You need to fast at least 18 hours before the test. If the fasting blood glucose is greater than 126 milligrams per deciliter, you have diabetes. Between 100 to 125 milligrams per deciliter, you have prediabetes. A second test is the oral glucose tolerance test, OGTT. You drink a special sweet drink, and then test your blood glucose after 2 hours. If the result is between 140 and 199, you have prediabetes, and if the result is over 200, you have diabetes. In order to determine how to prevent a chronic disease, you must know the critical cause of that disease. It is not enough to say that diabetes is caused by insulin resistance. The key is to find out why the cells are resistant to insulin. According to Dr. Neil Barnard, each cell of the body in a diabetic patient is like a gummed-up lock. Insulin is blocked by the accumulation of fat in the cell. According to Dr. Michael Greger, blood sugar needs an invitation to come into your cells, and that invitation is insulin. When insulin attaches to insulin receptors on a cell, it activates a series of enzymes that escort the glucose into the cell. Without insulin, blood glucose is stuck out in the bloodstream, unable to enter. With type 2 diabetes, 95% of all cases of diabetes, insulin production is not the problem. The problem is that fat in the cell has gummed up the lock. The solution is to remove the fat from the gummed up lock. One solution is to go on a low-fat or no-fat vegetarian diet. Another solution is to have bariatric surgery. There are two main types of bariatric surgery, gastric banding and gastric bypass. In one study, patients dropped 30 pounds in the first 6 months, which caused the fat inside their muscle cells to drop by 87%. Even though the participants were still overweight, their insulin resistance largely disappeared. Similarly, participants on a vegan diet were found to have 31% less fat in their calf muscles than in the control group. Only 3% of Americans are on a vegetarian diet. A much easier and similarly effective diet is the Casey diet. In the Casey diet, you eat 1 meal a day without snacks, but you can eat whatever foods you want in whatever quantity at that meal. You also eat a lot of fiber in this diet, equivalent to 5 servings of fruit or vegetables. This creates satiety, which means you tend to eat less food at this meal. Because most people consume about 1/3 of their calories as fat, you need to consume this fat. The mitochondria will only consume this fat after its stores of glucose and protein are used up, which usually takes about 12 to 18 hours. The last 6 hours of the day prior to your meal are spent consuming the previous day's fat. The result is that gummy fat in the mitochondria is consumed, and the cell becomes insulin sensitive by the time the daily meal is served. Exercise is also important in preventing diabetes. Exercise consumes the glucose stored in the muscle cells. Up to 15% or more of the circulating blood glucose can be transported into the cells by virtue of exercise. The Casey diet regime consists of aerobic exercise. I recommend at least 30 minutes of walking per day, along with at least 30 minutes of bicycling. I use a recumbent stationary bicycle and a treadmill for this purpose. If you walk and bike at a leisurely pace, you are not likely to get injured. Most doctors will prescribe medication for prediabetes. Metformin, the brand name which is glucophage, is typically recommended as the first line of treatment for type 2 diabetes or prediabetes as an off-label drug. It works by decreasing the liver's production of glucose. Metformin is not approved by the Food and Drug Administration for prediabetes. Lesson 3. Stop high blood pressure using potassium supplements and stop osteoporosis using alkalines. High blood pressure is one of the biggest silent killers. It is the second most important aspect to get under control after atherosclerosis in order to achieve optimum health. High blood pressure, hypertension, is usually defined as having a systolic blood pressure when the heart pumps over 140 and a diastolic blood pressure when your heart relaxes over 90. If the diastolic blood pressure is 90 or more, then you may have high blood pressure regardless of your top number. 90% of Americans over age 55 are at risk for hypertension. Women are more likely than men to develop hypertension, with half of women over age 60 having this condition and 77% of women over age 75 having hypertension. Hypertension affects 64% of men over age 75. Hypertension is frequently associated with obesity, smoking, excess dietary salt, lack of exercise, stress, and alcohol consumption. Many elderly people with hypertension have reduced kidney function, which prevents them from excreting excess salt. In the late 1990s, the DASH diet was modified by the American Heart Association to allow only 1,500 milligrams of sodium per day. This was because there was a high correlation between those with hypertension and high salt intake. The average American ingests 3,400 milligrams of sodium per day. The recommended daily amount is 2,325 milligrams, which is equal to 1 teaspoon of table salt. Most of the salt that Americans ingest comes from either processed food or from restaurants. Foods that are rich in potassium are important in managing hypertension because potassium helps excrete salt. The more potassium you eat, the more sodium you lose through your urine. Potassium also helps to ease tension in your blood vessel walls, which further helps to lower blood pressure. The recommended potassium intake for an average adult is 4,700 milligrams per day. Most adults consume half the recommended amount. Men average 3,000 milligrams, while women average 2,300 milligrams daily. Less than 3% of the population consumes the adequate intake of 4.7 grams daily. A ton of studies show that people who eat potassium-rich foods have lower rates of heart disease and stroke. According to the latest studies, people who regularly consume high potassium foods have lower blood pressure than those who do not. A recent major study of 300 nurses shows that potassium can lower your blood pressure even if it is in the normal range. People with normal kidneys have no trouble excreting excess potassium or excess salt. However, most elderly have some degree of kidney dysfunction. Too much potassium can be fatal. Patients should check with their doctor to see how much potassium supplementation is proper. High blood pressure is known to deleteriously affect every organ in the body. Its most serious effects are on the heart and the kidneys. High blood pressure often leads to stroke, congestive heart failure, atrial fibrillation, heart valve problems, and chronic kidney disease. Congestive heart failure, known as CHF, is the leading cause of hospitalization among people over age 65, accounting for about 20% of hospitalizations. Congestive heart failure occurs when the heart cannot pump enough blood to supply the body with freshly oxygenated blood. It affects about 5 million people in the United States. The 5-year mortality rate is about 50%. Under chronic high blood pressure, the walls of the left ventricle thicken. This means that the walls are no longer flexible enough to pump effectively. Fluids build up in the lungs because the left ventricle is a less effective pump. In addition, the enlargement can cause atrial fibrillation because the normal electrical signals are disrupted. The result is that blood pools in the atria, i.e. the upper chambers of the heart, causing blood clots to form. The most common type of heart valve problem is aortic stenosis. This occurs when the heart's aortic valve narrows. It is often caused by the buildup of calcium and cholesterol deposits on the valve leaflets. The narrowing prevents the valve from opening fully. As a consequence, the left ventricle must generate a higher pressure with each contraction to effectively move blood forward into the aorta. The increased pressure causes the left ventricle muscle to thicken. This leads to shortness of breath and swelling of the legs. Chronic kidney disease is caused by high blood pressure or by chronic high blood glucose levels or by both. Both hypertension and diabetes damage the glomeruli filters. Each kidney has about 1.2 million of these nephrons, all of which are capable of producing urine. By age 70, 30 to 50% of the body's glomeruli have been lost. 26 million adults have chronic kidney disease. This disease often goes undetected and undiagnosed until the disease is well advanced and kidney failure is fairly imminent. Once kidney failure occurs, it requires dialysis or a kidney transplant to maintain life. Osteoporosis is often referred to as a silent disease because it usually appears without warning and without symptoms until you fracture a bone. The term osteoporosis means porous bone in Greek. Bone is living tissue that is constantly being broken down and replaced. As people age, bone mass is lost faster than it is created. Osteoporosis-related fractures most commonly occur in the hip, wrist, or spine. In the United States in 2010, about 8 million women and 2 million men had osteoporosis. Osteoporosis affects approximately 20% of women aged 70, 40% of women aged 80, and two-thirds of women aged 90. Half of all fractures are of the hip, forearm, or wrist, and vertebrae of the spine. 75% of hip fractures occur among women, a 1 to 6 lifetime risk. For the year 2000, there were an estimated 9 million osteoporotic fractures. A third of the elderly will fall annually, with approximately 10 to 15% of these falls resulting in fracture. 90% of hip fractures result from falls. The most widely prescribed osteoporosis medications are the bisphosphonates. Alendronate, brand name Fosamax, is frequently prescribed for men. It decreases fractures of the spine but has little effect on other types of fractures. Women are prescribed Actonol, Boniva, or Reclast. Half of all patients stop their medications within a year. Bisphosphonates can cause stomach upset and ulcers of the esophagus, as well as kidney damage and even jaw necrosis, not to mention atrial fibrillation. Most of these side effects are mild and should not dissuade you from taking them. After 5 or so years, your doctor will probably take you off bisphosphonates since they become ineffective after this period. What do you do if the bisphosphonates are no longer effective or if they cause unpleasant side effects? The answer is to take an alkaline supplement, such as bicarbonate of soda. My preference is to take 3 tablets of Alkalife per day. Why take alkaline supplements? The answer is that the American diet is full of animal proteins due to all the meat we eat. According to the USDA, in its pamphlet, Boning Up on Osteoporosis, the sulfur in the meat we ingest forms acid when digested. This will temporarily cause the blood acidity to increase after a meal. To regain our natural alkaline balance, which is a pH of 7.46, our bodies must buffer the influx of acid. The typical buffer is calcium phosphate, which the body borrows from our bones. Though calcium phosphate is an effective buffer and neutralizer, taking this calcium from the bones increases our risk of osteoporosis. According to the book Building Bone Vitality by Lanoux and Castleman, the Western diet draws so much calcium from bone that a diet high in milk, dairy foods, and calcium supplements cannot replace the lost calcium. This is why countries that consume the most milk and dairy foods also have the highest rate of hip fractures. One solution is to go on a vegetarian diet. It turns out the recommended dietary allowance of 1,200 milligrams of calcium per day can easily be obtained by eating a plant-based diet. Many Asian cultures use no milk and dairy, yet they have little osteoporotic fracture rates compared to the Western world. The advantage of taking an alkaline supplement is that you can continue to eat your normal diet without unduly worrying about osteoporosis. Of course, it would still be advisable to get the recommended 5 servings of fruits and vegetables per day and to cut down on your intake of red meat. Lesson 4. Stop osteoarthritis with exercise and stop gout using vitamin C. Osteoarthritis is commonly known as wear and tear arthritis, as distinguished from rheumatoid arthritis, which is an autoimmune disease caused by inflammation from the attack of cartilage by white blood cells. Osteoarthritis occurs when the cartilage at the end of the bone wears away or becomes frayed and rough. Eventually, if the cartilage wears down completely, you may be left with bone rubbing on bone. Osteoarthritis commonly occurs in the hips, knees, and spine. About 1 in 3 people over age 65 have osteoarthritis of the knee, and about 1 in 4 adults will develop hip arthritis over the course of their lifetime. In the case of the knee, the femur, the upper leg bone, starts to press into the knee cartilage and eventually wears a hole in it, greatly decreasing its shock absorption function. You now have bone-on-bone contact. This tends to cause bone spurs, which make the contact even rougher. At this point, your doctor will probably recommend knee replacement surgery or possibly resurfacing. About 700,000 knee replacement surgeries are performed each year in the United States. By 2030, demand for knee replacements is expected to grow to 3.5 million. Osteoarthritis affects an estimated 54 million adult Americans, according to the Centers for Disease Control. By the year 2020, the number of adults with osteoarthritis will rise to 64.4 million. Most people over age 65 have radiographic evidence of osteoarthritis to some degree, although only 65% of those will have symptoms. Studies have shown that 80% of people over 75 have symptoms of osteoarthritis. The rate of osteoarthritis in the United States is forecast to be 78 million adults, 26% overall, by 2040. What is the cause of the degeneration of the cartilage in the knee and the hip? The answer is that the cartilage is fed by the synovial fluid in the joint. The synovial fluid provides lubrication for the joint and also contains nutrients and oxygen that are needed to feed the cartilage. Unfortunately, the mechanism of ingestion and excretion depend on motion. During movement, the synovial fluid held in the cartilage is squeezed out mechanically to maintain a layer of fluid on the cartilage surface. As one ages and becomes more sedentary, the cartilage goes through periods of decay from lack of nutrition. In addition, the waste products of the cartilage are somewhat acidic. If they remain in place, they tend to erode the cartilage. The net result over time is that the cartilage becomes thinner, stiff, less elastic, and more likely to tear. The joint becomes inflamed and swollen. Fissures and pits appear in the cartilage. Is there any way to stop this process? Epidemiological studies of long-term runners show that they generally are less likely to develop osteoarthritis in their knees than people of the same age who do not run. In other words, if you keep the cartilage well lubricated and well nourished, it will last a lifetime. The key is moderate exercise on a daily basis. I recommend at least 1/2 hour of walking and 1/2 hour of bicycle riding each day. The purchase of a treadmill or a recumbent stationary bicycle will prove to be good investments. Your knees and hips will thank you. Unlike the joints in the rest of the body, the joints of the spine do not contain synovial fluid. These joints consist of the vertebral discs and the two sacroiliac joints on the back of the pelvis. Nutrition to the spinal disc is caused by diffusion from the water around the discs. Physical activity causes the vertebral discs to swell with water and then squeeze it out. This process is necessary for the exchange of nutrients and for the excretion of waste. I recommend that you do lower back exercises such as bridges at least every other day. If nothing else, sit on your bed and bend down to your waist for 20 to 50 repetitions. Under stress, a disc's inner material may swell, pushing through its tough outer membrane. The entire disc can protrude into the spinal cord space. If the bulge does not press on the spinal cord, it is possible to have a herniated disc without any pain or discomfort. If the herniated disc does press against the spinal cord, the condition is known as spinal stenosis. The symptoms can often completely resolve over several weeks or months. In the majority of cases, a herniated disc will probably not require surgery. Gout is one of the oldest known and most common forms of arthritis. Gout happens when uric acid levels become elevated to as high as 7.1 milligrams per deciliter for women and 8.9 milligrams per deciliter for men. The uric acid then collects in the form of sharp uric acid crystals, usually in the big toe. These jagged uric acid crystals build up into large deposits called tophi. The crystals literally stab the soft tissues around the joint, causing the pain, swelling, and inflammation. The immune system then sends in white blood cells, which are ripped open by the sharp uric acid crystals. Once a disease of only the affluent, who could afford the purine-rich foods such as meat and beer, this, quote, disease of kings, unquote, has rapidly become a disease of every man. The prevalence of gout in U.S. adults is estimated at 3.9%, or 8.3 million people, favoring men over women by almost 3 to 1. The primary risk factor for gout is elevated levels of uric acid in the blood, known as hyperuricemia. Drinking over 2 beers per day increases gout risk 2.5-fold. Wine does not appear to affect gout risk. Hyperuricemia is estimated to affect over 21% of the United States population. Hyperuricemia doubles in frequency between ages 20 and 80. The levels of uric acid in the blood depend on the amounts of purines absorbed from the diet and the rate at which uric acid is excreted from the kidney. Excretion has the greatest effect on blood uric acid levels, with about 90% of hyperuricemia cases attributed to impaired kidney excretion. Treatments for acute gout attacks include nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and colchicine. NSAIDs have a significant gastrointestinal side effect. Although colchicine is approved by the FDA, it has a low therapeutic index, meaning that the dose required to exert a beneficial effect is near that which is potentially toxic. Similarly, corticosteroids have the deleterious side effect of osteoporosis. Is there any way to avoid drug side effects and still prevent gout? The answer is yes. Boosting vitamin C intake is a simple way to help prevent gout. In a study of 50,000 men published in the Archives of Internal Medicine, it was found that those with higher vitamin C intake had a consistently lower risk of developing gout than others. The study found that men with vitamin C intake of between 1,000 to 1,500 milligrams had a 34% lower risk of gout. Those who took an even larger dose had a 45% lower risk of gout. The Boston School of Medicine researchers concluded that for every 500 milligrams of vitamin C the men took, the risk of gout was reduced by an additional 15%. Is it safe to take megadoses of vitamin C? Dr. Robert Atkins, in his book Vita-Nutrient Solutions, recommends taking 5,000 to 10,000 milligrams of vitamin C daily. Dr. Linus Pauling once admitted that he took 14,000 to 18,000 milligrams of vitamin C on a daily basis to prevent colds and cancer. Dr. Pauling had no side effects from such megadoses. Some researchers suggest stopping at 10,000 milligrams since levels in excess of this amount may cause diarrhea. I myself take 6,000 milligrams of vitamin C daily. Lesson 5. Stop dementia with antioxidants and aerobic exercise. There are two main types of dementia. One, vascular dementia, which is related to mini strokes, transient ischemic attacks, and two, Alzheimer's disease. Both of these diseases display similar symptoms in the brain neurons, namely amyloid beta plaques and tau tangles. Most researchers believe that Alzheimer's disease is more prevalent than vascular dementia. In Japan, however, over 50% of dementia is attributed to vascular dementia. By age 70, 15% of the elderly will exhibit mild or severe dementia. By 85, 40% of the elderly will exhibit dementia, and by age 100, 75% of the elderly will exhibit dementia. The cause of vascular dementia is known. It occurs when vessels that supply blood to the brain become blocked or narrowed. 1/4 to 1/3 of strokes are thought to result in some degree of dementia. 25% of stroke patients develop new onset dementia within 1 year of their stroke. Another important cause of vascular dementia is the buildup of damage to the brain due to numerous mini-strokes, transient ischemic attacks. It is estimated that there are at least 5 mini-strokes to every stroke, and that some people can have hundreds of mini-strokes, most of which are not even recognized as having occurred. It is estimated that there are at least 5 mini-strokes to every stroke, and that some people can have hundreds of mini-strokes, most of which are not even recognized as having occurred. It is now estimated that the damaged area around a mini-stroke core may be 10 times the size seen on MRI scans. Common early signs of widespread mini-stroke damage include impaired planning and judgment, uncontrolled laughing and crying, declining ability to pay attention, impaired function in social situations, and difficulty finding the right words. Avoiding risk factors such as high blood pressure, diabetes, smoking, and high cholesterol can help curb the risk of vascular dementia. Among all factors, high blood pressure carries the greatest risk. Vascular dementia almost never occurs without it. The Casey diet reduces the likelihood of vascular dementia since it reduces high blood pressure, reduces high blood glucose levels, and reduces high cholesterol. The cause of Alzheimer's disease is unknown. According to the present NIH model, amyloid beta plaque is considered the cause of the dementia, along with the tangling of tau proteins in the neurons themselves. After 20 years, this model has failed to produce any solutions to Alzheimer's disease. Recent researchers are exploring the possibility that the amyloid beta plaque is simply the result of dying neurons rather than the cause. In this newer model, mitochondria death due to oxidative stress over time is viewed as the cause of Alzheimer's disease. The newer model suggests that mitochondria in the brain neurons undergo significant oxidative stress. 20% of the body's total oxidation occurs in the brain. Unlike normal cells, which typically replicate every 2 years, brain neurons last your whole life. The mitochondria, which are the power cells in the neurons, are damaged by free radicals, and over time they lose their ability to properly feed the neurons. When the mitochondria function in a neuron falls below 60%, the neuron begins to die and leaves behind amyloid beta plaque as the byproduct of its death. The plaque itself increases inflammation, which damages the surviving mitochondria, causing a cascade of neuronal death. According to Kathy Frederick, the number of healthy mitochondria decrease in number over time due to exposure to free radicals. To make matters worse, when the mitochondria become damaged, they produce more free radicals, setting up a vicious cycle. A team of researchers showed that the tissue of a 90-year-old man contained 95% damaged mitochondria compared to almost no damage in that of a 5-year-old. According to Kathy Frederick and her colleagues, Lloyd Demetrius, Emily Rios, and Jane Driver, the way to keep your mitochondria healthy is to take antioxidants. The best way we can protect mitochondria in the brain is to use L-carnitine, alpha-lipoic acid, and coenzyme Q10. Other antioxidants include vitamins A, C, and E. However, use of vitamins A and E, the fat-soluble vitamins, have been found to be deleterious due to the overdose possibilities. There is some evidence that resveratrol, an antioxidant in red wine, protects mitochondria against oxidative damage. In short, a diet rich in fruits and vegetables is likely to prolong the life and vitality of mitochondria. In addition, regular use of aspirin or statin medication reduces the inflammation from the amyloid beta plaques and thereby reduces damage to the surviving mitochondria. The second way to ensure the health of neuronal mitochondria is to encourage the body to produce new mitochondria. It has been shown that the body adapts to aerobic exercise by increasing the number of mitochondria within the cells, a process called mitochondrial biogenesis. In fact, one study showed that 3 months of moderate to intense aerobic exercise increased the number of mitochondria in thigh muscles by 50%. Another study showed that elderly men who walk 2 miles per day have only half the rate of dementia as found among men who walked less than a quarter mile per day. Finding a way to increase the number of mitochondria in the brain is a promising way to cure Alzheimer's disease. In one experiment, Roger Unger and his colleagues at the University of Texas Southwestern Medical Center engineered a virus to deliver the gene for the hormone leptin, which controls appetite. A side effect of this experiment was that the fat cells of the rats had an unusually large number of mitochondria. If one could perfect this technique, one could treat Alzheimer's simply by increasing the number of mitochondria in the neurons of the brain. Other causes of dementia include vitamin B1 deficiency, usually due to excessive alcohol intake, vitamin B12 deficiency due to reduced stomach acidity and lack of intrinsic factor, depression, and chronic stress. Chronic stress results in high levels of cortisol or glucocorticoids, which can damage the hippocampus, an organ important in developing long-term memory. In addition to the above, 20% of men with Parkinson's disease go on to develop dementia. Elevated levels of homocysteine also lead to dementia, as does hypothyroidism. Untreated Lyme disease and syphilis are likewise known to cause dementia. Untreated hydrocephalus, or chronic subdural hematoma, can also result in dementia. Chronic trauma to the brain, as in football concussions, can lead to chronic traumatic encephalopathy, CTE, previously called dementia pugilistica. Finally, toxic substances such as arsenic, lead, thallium, manganese, and mercury can cause dementia, as can a number of industrial solvents and insecticides. There are many medications that can also result in impaired memory as a side effect. For example, Ambien, commonly prescribed as a sleep medication, can result in short-term memory loss. Another example is statins, where mild cognitive impairment is listed as one of the black box warnings. Many high blood pressure medications, for example, Aldum and Aldodril, antidepressants, for example, Elavil and Prozac, pain medications, for example, Motrin, proton pump inhibitors, for example, Nexium and Prilosec, diabetes medications, for example, Dimolor, and antibiotics, for example, Kybroxin, warn that the side effects may include impaired cognitive function. Polypharmacy, where a single medication by itself is not a problem, can result in mental confusion and memory loss when combined with other drugs.